This past weekend, I was in Moncton, New Brunswick with Shoppers Drug Mart and President's Choice for the Shoppers Love You weekend. And as part of the weekend event, we attended the New Brunswick Heart Truth Gala. Get the right side here. That was in support of the Heart and Stroke Foundation of New Brunswick. So I thought this week we'd talk a little bit about heart health and some of the things that you can do that are in your control to help lower your risk of heart disease and stroke. But before we get into that, I'm going to tell you a few facts about heart disease. These are not fun facts. I usually like to share fun facts. These aren't fun, but they're important. 1 in 5 Canadians has hypertension or high blood pressure. 9 out of 10 Canadians have at least one risk factor for heart disease or stroke. These can include things like smoking, alcohol consumption, obesity, inactivity, high blood pressure, high cholesterol, but also stress. So we're going to talk a little bit about things that we can do to help lower our chances of contracting heart disease or having a stroke. While 1 in 5 Canadians have hypertension and 90% will develop hypertension over their life, hypertension is the #1 preventable risk factor for stroke, and it significantly increases the risk for all cardiovascular disease outcomes, including coronary artery disease and congestive heart failure. So I want to really focus on this stress aspect because people often think of all of those other ones that I previously mentioned as risk factors, but not so much stress. I'm going to read this little blurb to you. Stress affects both your mind and body. Too much stress can raise blood pressure and cholesterol levels, which increases your risk of heart disease and stroke. It's important to identify the sources of your stress so that you can try to eliminate those factors. So the more risk factors you have, so if you're someone who smokes, you have diabetes, you're overweight, you're inactive, you're stressed, make your grader higher than someone who only has 1 or 2. So the more risk factors we're able to manage, the lower our risk factor will be for heart disease. And stress is such a big one. So many people are stressed, and it just really upsets me knowing how many people think that it's okay and normal to go through their life with such high stress levels. It might be normal, that doesn't make it okay. Especially if you have some of those other risk factors like age, gender, family history, a history of having heart problems yourself. The more you can manage those risk factors that we can do something about, the lower your chances are going to be. How's this for ironic? I had to stop my recording to go answer the door, and there was someone there collecting money for the Heart and Stroke Foundation. So stress really, really does a person in, and we don't worry enough about the effects of stress. We think that we should just live with stress, and in North America we almost pride ourselves on being stressed. So I really urge you to find ways to help reduce your stress levels if you are living in a stressful situation. I'm launching a brand new Yoga for Stress and Anxiety program next week on May the 14th. If that is something that you might be interested in, I'll put the link down below. But honestly, there's a million different ways to manage stress levels. I promise you, lowering your stress will make you happier overall and will help lower your risk for heart disease. So that is my advice for this week, is help your heart by helping yourself. And if you are stressed to the max, please start to research ways that you can start to manage your stress and bring those levels down so that you can live a healthy, happy life with your friends and family. That is it for me today. I hope you're having a wonderful week, and I will talk to you on Friday.